Start. For blood synthesis, we have bone marrow. And bone marrow, we have stem cells. Which cells? Stem cells. Stem cells. They are inside, yani here. There's stem cells. By dividing, they give, as we know, two classes, two types, myeloid and lymphoid. Myeloid and lymphoid. Lymphoid for lymph cells, myeloid for other all cells. Red blood cells, leukocyte, white blood cells, thrombocytes, وهكذا. Red blood cells, how they are, we have red blood cells, which shape? Like this shape, yes? This is from lateral. And like this, if we see from upside, what we have inside red blood cells? Hemoglobin. Hemoglobin consists of hem and globin. Globin is two chains, alpha and beta, every one about 140 amino acids, about 136 like this amino acids. Hem is porphyrin plus iron connected to porphyrin by the help of enzyme ferrocolytase. This is how to prevent. Porphyrin is coming from some reactions. It started with glycine, protoporphyrin, coproporphyrin, porphyrin, then iron connected by ferrocolytase. Then we are doing hem then connected with globin, which consists from alpha and beta chains. Then we do hemoglobin. Red blood cells, the membrane are synthesized in bone marrow. While hemoglobin is doing, we do red blood cells. Red blood cells, we need for red blood cells bone marrow, normal bone marrow. We need for synthesis of red blood cells DNA, sure, because we need dividing of cell. For DNA, we need B12, vitamin B12 for DNA. What else we need for synthesis red blood cells? Iron. And we need also growth factors. The most famous growth factor is erythropoietin, and it's come from kidney. We are doing red blood cells. It's continuously, every day, we do red blood cells. Again, please, repeat again. For red blood cells, we need normal bone marrow, DNA, vitamin B12, iron, we need growth factor, most famous erythropoietin, and we get it from kidney. There is other growth factors also, for example, interleukin 1 also as a growth factor. Then red blood cells become mature. We know that red blood cells, they have this shape, and they have from 6 to 8 micrometer diameter. Understood? And hemoglobin, we know this hemoglobin for oxygen, yes, for oxygen transport. And hemoglobin gives red color for red blood cells. Red color. How many days they can live? Red blood cells? 120 days normally. 120 days normally. Then they go to spleen. In spleen, they get hemolysis of red blood cells. Hemoglobin, then by hemolysis, it's become indirect bilirubin. Indirect bilirubin is fat soluble, toxic. We need to detoxicate indirect bilirubin. About iron, disconnected of iron. Iron again transport to bone marrow, and then bone marrow use this iron again for new red blood cells. About iron, we get iron from outside, yes, by food, iron. Then iron in stomach, in intestine, it's absorbed. Then we have transport protein for iron is transferrin. It transports iron to liver and to bone marrow and to our cells, because we use iron in our cells in mitochondria. And some irons transport to bone marrow. It's storage there in bone marrow in sideroblast cells. Iron, understood this? Then indirect bilirubin we have to detoxicate. We combined it with bilirubin, and they transfer by portal vein to liver. Then liver intake this indirect bilirubin, convert it into direct bilirubin by glucuroneal transferase enzyme. Direct bilirubin, it excretes with bile to intestine. Here, direct bilirubin, by connection with hydrogen, become urabilinogen. Urabilinogen, one part of urabilinogen, it's reabsorbed to liver. Other part goes direct. Urabilinogen, this part in liver, it's detoxicated fully. Second part of urabilinogen by 2 hydrogen, it's become sterca-bilinogen. Sterca-bilinogen, one part reabsorbed by rectal vein. Other part, it goes direct by stool. Sterca-bilinogen gives brown color to the stool. By rectal vein, it goes to kidney and excretes by urine. Then in stool we find sterca-bilinogen. In urine we find sterca-bilinogen. In stool we find sterca-bilinogen. It gives brown color. In urine we find sterca-bilinogen, also not urabilinogen. Urabilinogen, if we will find urabilinogen in urine, it's pathology. It must be sterca-bilinogen. Anemias due to what? 3 major mechanisms of anemia. 3 major mechanisms of anemia. First one, anemia due to blood synthesis disorder. This erythropoietic means the problem here. In bone marrow. Anything in bone marrow, the bone marrow is damaged. No DNA, no vitamin B12, no iron, no absorption, أي حاجة. This erythropoietic anemia. Second, hemolytic anemia means the problem here. They cannot live 120 days. They live earlier. They died earlier. It could be 2 types. They can be died inside vessels, then we call it intravascular hemolysis. Or in spleen, we call it intracellular hemolysis. Intracellular hemolysis more heavier than intravascular because they digest very heavy. Third type of anemia, post-hemorrhagic due to blood loss. Post-hemorrhagic. This could be 2 types, acute and chronic. This is 3 major basic mechanisms of anemia. This erythropoietic, hemolytic, and post-hemorrhagic anemia. Thank you very much. Start. Let us solve case about hemograms, about anemias. This is one type of anemia. We have to find which type of anemia here. Look, please. RBC is 2.7. It's less than normal.
Yes, sir.
because the minimum 3.7 among female. Then hemoglobin 76 is less also, to a minimum 110, 100, like this. CI, color index. Color index means how much hemoglobin in red blood cells normally, يعني how much he gives color for red blood cells. They call it color index. How to calculate this? 3 multiplied by hemoglobin divided by first 3 numbers of red blood cells. First 3 numbers means 270, like this. And 3 multiplied by hemoglobin of this patient. 3 multiplied by 76. And divide by first 3 numbers of red blood cells, 270. And it will be about 0.85. Normally, color index is from 0.85 till 1.05. So it's normal. Then reticulocytes 0. Who are reticulocytes? This is previous immature cells of red blood cells. Means last cell is red blood cells, before it reticulocyte. Reticulocytes must be about 2 to 3% in our peripheral blood, and they get out from bone marrow. Why we need this? We need this to ensure about the work of bone marrow. Is he working or not? Is he good working or not working? While it's 0, it seems that bone marrow not working. Platelets. So first, what give me about bone marrow position is reticulocyte. Now I approximately recognize that bone marrow is damaged, might be. Now let us see, is there something proof this or not? Platelets 28 must be minimum 150 or 180. 28, very less. Okay. If you see leukocytes, they are also less. They are also less, even in percentage number. They are less. It means that all 3 blood cells are less. Red blood cells less, platelets less, and leukocytes less. We call it pancytopenia. Pancytopenia. 3 blood cells are less. Understood? When we find pancytopenia, it's sure bone marrow problem. He cannot doing red blood cells at all. Understood? So this is bone marrow. This is erythropoietic anemia, first mechanism. Now, which one among them? Because could be B12 deficiency, could be iron, yes. Could be bone marrow damage. In this case, this bone marrow damage, because 3 blood cells are less. But bone marrow damage, pancytopenia, we can find also in B12 deficiency anemia. Not only bone marrow damage. B12 deficiency anemia also gives pancytopenia. So what also decreased there and there in B12 also reticulocytes decreased. How to differentiate between bone marrow damage and B12 deficiency anemia? In B12 deficiency anemia, under microscope, we will find megaloblast. He didn't give her megaloblast. So this is purely bone marrow damage. We can call it aplastic anemia. Aplastic anemia. This one, this type of anemia. Aplastic anemia. Thank you very much. Let us see second case, other hemograms of anemias. Let us find which type of anemia here. Start. Red blood cells 3. Is it less or less than normal? Less than normal. Hemoglobin 70. Less. CI, color index less. We said it's before between 0.85 till 1.05. It's less. Means that hemoglobin less. First, what we have to note. Color index shows hemoglobin mainly. Means hemoglobin less. Reticulocyte 0.3 less. It seems something in bone marrow. Yes, because reticulocytes says about bone marrow. Might be bone marrow. In bone marrow, I said once that we need what? We need bone marrow, we need DNA, we need iron, we need B12, we need growth factors. Let us see which one among them is deficit. Platelets, normal. The leukocytes, normal. So not 3 blood cells are less, just red blood cells less. Understood? Not platelets, not leukocytes, just red blood cells. It means there is something deficit for mainly red blood cells. Could be erythropoietin or could be iron. Understood? It seems iron, yes, because color index says it's more less, means the hemoglobin is iron. But hemoglobin also, there is, except iron, there is some other problem. For example, thalassemia. Thalassemia, also hemoglobin problem. Sickle cell anemia, also hemoglobin problem. But what will help me now? How can I differentiate? Is it iron deficiency anemia or thalassemia or sickle cell anemia? By microscopy. He said microcytes. Microcytes and hypochromia. Hypochromia means less color index. Microcytes and hypochromia is more significant for iron deficiency anemia. Triad for iron deficiency anemia. Hypochromia, color index less. Hypochromia, microcytes, annulocytes. Annulocytes means red blood cells with hole, no color in this hole. Understood? This is triad for iron deficiency anemia. Microcyte, annulocytes, and hypochromia. So this is iron deficiency anemia. Thank you. This case of anemia hemograme. And let us find which type of anemia here. Red blood cells 2.5. Less or less? Less. Hemoglobin 70? Less. Color index 0.84. Normal. Might be normal. Reticulocytes 18. Very, very, very high. First of all, it means that bone marrow normal. But not only normal, he working very hard. Second of all, reticulocytes, when they become very more, it means that this type of anemia is acute. Acute anemia. So reticulocytes, by this number, it gives multiple information. Can you imagine? Just one cell, it gives multiple information. First of all, bone marrow normal. Second of all, that this type of anemia is acute. Platelets 180, normal leukocytes 14 high. Means there is some damage or something like this. Damage. Leukocytes high, something damage. Now look, please. Acute anemia could be two types. Post-hemorrhagic bleeding or acute hemolytic. Acute hemolytic anemia. Acute hemolytic anemia, usually it's acquired toxic anemia. When something toxins enter to our body in blood, it causing destroyed our red blood cells, anemia. They are destroyed. There. Understood? This one. So now we have problem. Which problem? This is acute hemorrhagic anemia or acute hemolytic anemia. Which one? Acute hemorrhagic or another? Who will help us? Microscopy. When we see polychromatophilia, this is also means that this anemia is acute, because polychromatophilia is immature cells of red blood cells. Immature. They came from bone marrow. It means that bone marrow, he tried to maintain red blood cells. Maintain, very hard working. That's why immature and very young cells, they get out from bone marrow to blood. It means that this is also acute anemia. What about basophilic stippling? If we have acute hemolytic anemia, it means some toxins enter to our body and destroyed our blood cells, and these toxins reach to bone marrow and become to destroy bone marrow. To destroy bone marrow. Then bone marrow give some pathological form of red blood cells. Like this, basophilic stippling, this red blood cells, and inside we see like these points. This is, we call it basophilic stippling. So which type of anemia is this? Again, we have two types of anemia of acute hemorrhagic or acute hemolytic. Acute hemorrhagic, we don't find any pathological cells in microscopy. This is, we call it normal cells. Basophilic stippling is pathological cell. If it's acute hemolytic, toxic, so we will find some pathological cells with basophilic stippling. So this is acute hemolytic anemia, toxic mainly, or immune, could be immune, blood transfusion. Understood?
Yes.
Thank you. Start. Let us see this case of anemia from hemograme. Which type of anemia in this case? Red blood cells 3.6. Could be normal if it's female.
Yes, I'm female.
If it's male, then not normal.
No.
Hemoglobin 95. Could be normal if it's female. If he male, so no, less than. Color index 0.8. Yeah, no. Reticulocytes 4. Bone marrow working. Yes, he is working. Platelets 280. 300, normal. Leukocytes 16. There is some damage. Understood? And this all proof that bone marrow is working. These all cells. Means this is not bone marrow type. What is this? For reticulocytes, as I said, and we see polychromatophilia in microscopy, means that this is acute anemia. Acute anemia could be two types: hemolysis and hemorrhagic. If hemolysis, we have to find some pathological cells as basophilic stippling, for example. There is no. So this is post-hemorrhagic anemia, acute post-hemorrhagic anemia. Why 16 leukocytes? Because he get damage, acute bleeding. He get damage and then bleeding. Understood? Have we seen this patient? No. But logical thinking and with knowledgement of blood system, we already get whatever is other. Understood? Thank you. Start. Let us see which case of anemia in this case. RBC is 3.02, yeah, 3.02 less. Hemoglobin 72, more less. Could be hemoglobin problem, yes? Again, please. Red blood cells 3.02 less. Hemoglobin 72, more less. Could be hemoglobin problem. And who can prove this? CI 0.7, more or less. So might be hemoglobin problem. Hemoglobin problem, I said that there are three types problem of anemias. Hemoglobin problem. Who are they? Sickle cell, thalassemia, and iron deficiency anemia. Yes?
Yes, sir.
Now, platelets 400 very more. Later I will discuss why platelets very more. Leukocytes 9. Now we faced with three types of anemia: iron deficiency, thalassemia, sickle cell. Who will help us? Microscopy. We have target cells. Target cells means like this, as target board. It's most specific for thalassemia. So this is thalassemia. Yes? Now, one question developed among you.
Yes, sir.
Why platelets very more? Why platelets very more? 400 very more. Look, please, why? Thalassemia, the problem that these blood cells are, they are destroyed intravascularly, in small vessels. They are destroyed. Then, by the future, if our red blood cells in vessels, they are destroyed here, in the future they will cause what? Block, clotting. That's why platelet is very more. Understood? Thank you. Start. Let us see which case of anemia in this case. Which type of anemia in this case. RBCs 3.8 could be normal if it's female. Hemoglobin 68. This is hemoglobin problem. Hemoglobin problem. Could be iron deficiency, could be sickle cell, could be thalassemia. This hemoglobin problem, usually. Reticulocyte 0.8 means bone marrow bad working. 0.1, yes, sorry. Bad working bone marrow. So this is in bone marrow. In bone marrow problem. Now look, please, logically. This in bone marrow problem, and this is hemoglobin problem. Bone marrow problem and hemoglobin. Wait, please. Bone marrow problem and hemoglobin problem. Now, I will repeat again what we need for hemopiesis at all. We need bone marrow, we need DNA, we need growth factors, we need B12, we need iron. Iron. This is for bone marrow. And this also hemoglobin problem. So, mixed bone marrow and hemoglobin problem, this is iron. Iron, logically. Understood? Let us prove platelets normal, leukocytes normal, وإلى آخره. Who will help us in this case? Microscopy. Anisocytosis, poikilocytosis, annulocytes, whole with whole. I said once, triad for iron deficiency anemia. Hypochromia, 0.53. It's very less. Hypochromia, microcytes, and annulocytes. This is iron deficiency anemia. Understood? How to treat iron deficiency anemia? To eat iron. No, I'm joking. There's some drugs with iron, yes. Thank you. Finally, let us see which type of anemia in this case. RBC is 1.44, very less. Hemoglobin 66.
Very less.
But here you have to know that this more or less of red blood cells.
Yes.
Because color index 1.4 is hyperchromia. The opposite. Means that red blood cells less. Then reticulocytes 0.4, bone marrow problem. Platelets 120, less. Leukocytes 2.8, less. 3 cells less. We call it pancytopenia. 2 types of pancytopenias. It could be bone marrow damage or B12 deficiency anemia. B12 deficiency. Who can help me in this case? Microscopy. In B12 deficiency anemia, we find megalocyte, megaloblast. This. But I want you to note something for B12 deficiency anemia. No. Note something here, please. Eosinophils 5, very high. Very high, yes? And note something. Color index very high, 1.4. Look, for B12 deficiency anemia, triad characteristic for B12 deficiency anemia. Pancytopenia, color index more than hyperchromic, and megalocyte, megaloblast. But I want to ask you to note something. Eosinophils 5. Eosinophils become more in 2 cases. Allergic reaction or warm. For B12 deficiency anemia, its most characteristic is worm disease, worm in intestine. Worm eating B12. What we eat, B12, this worm is eating B12. That's why B12 become less. So, conclusion, B12 deficiency anemia. Thank you.